Hi, and welcome to the informational video series on the rules for registered family. This is video number 5. In this video, we will discuss infant and toddler care, general requirements, feeding, furniture and equipment, safe sleep, diaper changing and toileting, cleaning and sanitizing infant and toddler areas. My name is Kelly Stuckey, and I work for the Child Care Licensing Division as a licensing specialist in the East Portland unit. The Child Care Licensing Division hopes that you find these videos informative and supportive in learning about the new registered family rule set. During each video in the series, we will explain some of the key features and highlights of the registered family rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Registered Family Rulebook for the full list of requirements and rules. Okay, let's get started. Let's discuss the updates related to infants and toddlers, particularly in terms of movement and the use of restrictive equipment. Infants and younger toddlers must be given opportunities to interact and be near one another. This helps with their social development and promotes a sense of connection, which is important for their emotional well-being. Encouraging interaction between children, even at a young age, supports learning and the development of social skills. A key update is limiting restrictive infant equipment, such as bouncers, exercisers, swings, infant seats, high and low chairs, or structured infant carriers must be limited in use. These types of equipment restrict an infant's natural movement, which can impact their physical development. The new rule limits the use of these types of equipment to no more than 30 minutes in any 2-hour period. This ensures that the infants have ample time to move freely, which is crucial for developing their motor skills and muscle strength. There are exceptions where the 30-minute time limit may not apply. For example, if the infant is actively engaged in eating, stroller walks, or car rides, the time spent in restrictive equipment may exceed the 30-minute limit. These activities are necessary for the child's routine, but they don't restrict their development in the same way. These updates are designed to support infants' physical and social development by limiting the use of equipment that restricts their movement and encouraging natural interactions and activities. Next, let's cover important updates regarding the care and feeding of infants, particularly around human milk, formula, and the introduction of solid foods. There are now specific requirements for the storage, preparation, and serving of human milk and formula. These updates help ensure that the feeding practices are safe, hygienic, and support the health of the infants in care. These guidelines include maintaining proper temperatures for milk storage and ensuring formula is prepared according to the manufacturer's guidelines to prevent contamination. A new rule has been introduced that no juice of any kind may be served to infants. This helps reduce the risk of early childhood cavities and ensures infants are getting nutrients they need from breast milk or formula, not from sugary beverages. Another important update is that infant formula cannot be mixed with cereal, fruit juice, or other foods unless there is written permission from a medical practitioner. This rule is in place to protect infants from unnecessary additives that may interfere with their health or proper nutrition. Lastly, infants under 6 months of age should not be given water to drink unless there is written approval from a medical professional. At this stage, water can interfere with the infant's ability to absorb necessary nutrients from breast milk or formula. These changes ensure that feeding practices are safer and more appropriate for the developmental needs of infants, helping to promote their overall health and nutrition. We will now move on to updated rules for cribs, portable cribs, and play yards in family childcare settings, ensuring the safety and comfort of infants during nap time. You must provide each infant with an individual crib, portable crib, or play yard to ensure a safe and personal sleeping space. However, you are not required to have a separate crib, portable crib, or play yard for every enrolled infant, only enough for each infant to have their own when needed. If properly cleaned, sanitized, and fitted with fresh bedding, the same crib, portable crib, or play yard may be used by multiple infants at different times. This is to ensure that each infant has a safe, personal sleeping space. The cribs, portable cribs, or play yards must meet Consumer Product Safety Commission standards. Additionally, you must have documentation from the manufacturer or retailer showing that the crib was manufactured after June 28, 2011, or that the play yard was manufactured after February 28, 2013. This ensures that the equipment used is up to date with current safety standards. The sleeping surface must be firm, flat, and non-inclined to reduce the risk of suffocation or unsafe sleeping positions. The mattress must meet the following criteria. It should fit tightly in the crib or play yard with no gaps between the mattress and the sides of the product. The mattress must be covered with a durable, washable, waterproof material. The mattress must be firm enough to hold its shape and not indent or conform to the infant's head. The mattress must be covered by a tight-fitting sheet that stays in place with regular use, with no slack or bunching. These requirements aim to ensure that infants have a safe, secure sleeping environment that complies with the latest safety standards, reducing the risk of injury or suffocation. This slide continues to discuss more changes regarding infant sleep equipment, safety, and developmental materials in family childcare settings. It's important to note that bassinets, stacking, wall, or modular cribs, and crib bumper pads are prohibited. These types of equipment do not meet current safety standards for infant sleep environments. Sheets must be changed when soiled, before use by another child, and at a minimum of once a week. This ensures a clean and sanitary sleeping environment for each infant. In support of traditional indigenous practices, cradle boards or other traditional indigenous sleep equipment may be used as a sleep surface for infants. However, caregivers must exercise caution and make sure not to overbundle or overheat an infant while using this equipment, ensuring the child's comfort and safety. Next is an important update regarding materials and toys in registered family child care settings. You must offer a variety of materials that are developmentally appropriate and stimulating to a child's senses. This means including materials that encourage exploration, creativity, and engagement, tailored to the children's ages and developmental levels. Materials and toys must not pose a choking hazard, ensuring the safety of younger children. This includes avoiding small objects with a diameter less than 1 1/4 inches, plastic bags, styrofoam items, rubber or latex balloons. Materials must be safe and in good working condition, and items must be removed from the child care home as soon as a program becomes aware an item has been recalled by CPSC. Check with your CCR&R or your licensing specialist if you need to learn about how to keep up to date on recalls that could affect your program. These updates emphasize the importance of maintaining a safe and developmentally appropriate environment for infants, ensuring that equipment is not only functional, but also safe for children in care. As we continue to review equipment for infant and toddlers, we will now talk about infant equipment restrictions and high chair safety in registered family childcare settings. Certain infant equipment can no longer be used due to safety concerns. These include baby walkers, doorway jumpers, accordion safety gates, bean bags, water beds, foam pads for sleeping, unstructured infant slings or wraps. These items pose risks such as fall hazards, suffocation dangers, or lack of proper support for infants. If you use high chairs, they must comply with Consumer Product Safety Commission standards and include a broad base to prevent tipping, a latch to keep a child from raising the tray, T-shaped straps, or a guard to prevent entrapment or sliding out. If you use clip-on chairs, the chairs must have straps to prevent a child from sliding out and ensure safety. These changes are designed to enhance infant safety and reduce risks associated with improper equipment use. Now let's review the updated Safe Sleep Guidelines for infants, which have been clarified to align with the American Academy of Pediatrics recommendations. These changes emphasize safe sleep practices that protect infants while they are asleep. While infants are sleeping, you must monitor them frequently to ensure their safety. This includes checking to make sure that the infant is breathing properly, is not overheated, is not in distress, and does not need any immediate assistance. Infants must always be placed on their backs to sleep. They should be placed on a flat, firm, non-inclined surface to reduce the risk of suffocation or other sleep-related accidents. This is one of the most important ways to keep infants safe while sleeping. Infants who are able to roll from back to front or back to side may remain in the sleep position they assume. Once an infant can roll over on their own, it's safe for them to sleep in the position they prefer, as long as they are initially placed on their back. Some other important updates regarding infant safe sleep focuses on what should and should not be in or around the infant's sleep space. Infants must never have their heads or faces covered by blankets, linens, or any other items while they sleep. Additionally, no items shall be placed over the top or sides of the crib, portable crib, or play yard, such as tents or sheets. This ensures that there is always enough airflow and reduces the risk of suffocation or overheating. Items such as headwear, for example, hoods, hats, headbands, bibs, necklaces, and garments with ties or drawstrings must be removed from the infant before they are laid down to rest. These pose serious suffocation and strangulation risks. Swaddling or any other type of clothing or covering that restricts the infant's arm or leg movement is prohibited at all times, even when the child is not sleeping. Additionally, weighted blankets, weighted clothing, or any other weighted objects should never be placed near or on a sleeping infant. Finally, only a plain pacifier is allowed in the crib, portable crib, or play yard. No pacifier clips, bottles, toys, pillows, stuffed animals, blankets, or bumpers shall be present. These items pose a suffocation or choking hazard, so it is important to keep the sleeping area clear from all objects except the infant. If you are holding or carrying a sleeping infant in a structured infant carrier and are engaged in an activity, you must move the infant to a safe sleep surface as soon as the activity is finished. If you are holding a sleeping infant, you must remain awake, alert, and focused on the infant and be able to immediately observe or feel for any signs of distress. This ensures that the infant is always in a safe position and can be responded to quickly if needed. These updates ensure that infants sleep safely while maintaining alignment with the latest pediatric guidelines. It's critical to continue providing a safe sleep environment for all infants to prevent sleep-related risks. By keeping the sleep space free of any unsafe items and following these best practices, we can help ensure that infants rest safely and comfortably. Now let's go over the updated guidelines for diapering practices in family childcare settings, which focuses on ensuring the health and safety of the children in your care. Diapers must be checked at least every 2 hours unless the child is sleeping, or more frequently if the child's needs require it. Diapers should be changed promptly to prevent discomfort and minimize the risk of skin irritation or infection. The rules have been clarified regarding the diaper changing area. It's essential that this area is maintained with cleanliness and hygiene to ensure a safe and sanitary environment for diaper changes. The diaper changing area should be equipped with everything necessary for safe and efficient diaper changes. The updated rule allows for the use of cloth or reusable diapers in a family childcare setting. However, these must be stored and cleaned according to specific requirements to prevent contamination and ensure hygiene. You must ensure the diapers are safely stored and properly cleaned between uses. A disinfecting solution must be available at each diaper changing area and kept ready for immediate use. The disinfectant must be stored out of children's reach to avoid any accidents or misuse. After each diaper change, the area must be cleaned and disinfected to maintain a hygienic environment. These updates are designed to enhance the cleanliness and safety of the diapering process, helping prevent potential health risks like skin infections or contamination. By following these guidelines, providers can ensure that the diapering area is safe, sanitary, and comfortable for all children in care. For our final topic to review includes updated clarifications regarding sanitizing versus disinfecting surfaces in family childcare settings. These updates are designed to ensure proper cleaning practices that maintain a healthy environment for children and caregivers. For sanitizing, surfaces and items that are frequently touched by children should be sanitized regularly to reduce the risk of illness, but may not require the strong chemicals needed for disinfection. These include tables, chairs, and play equipment used by children. And for disinfecting, high-touch surfaces that may come into contact with bodily fluid should be disinfected. These include diaper changing areas, bathroom fixtures, and kitchen surfaces. It's important to follow these guidelines to maintain a clean and safe environment. Sanitizing and disinfecting help prevent the spread of illness and ensure that children are in a safe, hygienic space. Thank you for watching this video in our informational video series. You can now move on to the next video in the series. If you have any questions, please contact your licensing specialist. For more information, visit our website at www.oregon.gov/DELC.